Every year, nearly 800,000 Americans suffer a stroke. It is the leading cause of severe long-term disabilities in the U.S.
But a groundbreaking study is offering hope to reduce that number. Our Dave Delosier joins us now with more on this study. Dave?
Yeah, Eric and Susan, you know, it's really very well known that time is a very important factor when it comes to treating a stroke. And this study doesn't change that. The sooner a stroke patient gets treatment, the better the chances of a positive outcome. But what this study found is the window of hope for some patients just got a little bit wider.
I went out to Gammon Road and I started jogging, but I knew something was wrong. I crossed over, but then bam.
Fortunately for Steve D'Onofrio, a nurse found him and called an ambulance.
So on the Sunday that Steve came in, I was on call for our acute stroke team.
Because he got to the hospital within a 3-hour window, the clot-busting drug TPA was given to Steve and surgery was done to remove the clot in his brain. It allowed him to recover.
My life is totally different. You know, my stroke made great things happen in my life too, so.
Well, time's always very important for someone who's just had a stroke. All of our treatments are exquisitely time sensitive.
But a new study is opening the window of hope for stroke patients who can't get medical care in less than 6 hours.
So what the new research shows is that, yes, you can use the more advanced imaging capabilities that we have these days and identify people whose brains are still salvageable up even as far as 24 hours.
If the advanced imaging shows minimal damage to the brain tissue, a catheter can be used to remove the clot and restore blood flow.
We see that he fills the arteries quite well.
And the study showed significant difference in those who got the surgery within 6 to 24 hours and those who didn't.
And it was a big difference. About half of the people ended up being functionally independent if they got the treatment, and only 13% were functionally independent if they did not get the treatment.
Not every stroke patient will be helped by this new protocol, but for those who do.
Yes, I think it expands the window of hope is a good way to put it.
Now, UW Hospital has been moving in the direction of this new protocol in recent years, but with this new research, they are actively developing a protocol to implement it and hopefully help more stroke patients. But Eric and Susan, we just can't say it too many times. For anybody who thinks they're having the symptoms of a stroke, you've got to seek treatment right away. You've got to get to an emergency room because every minute matters.
And you've got to know the symptoms, too.
You do, absolutely.
Way to end on an inspiring note. We're sorry to say this is your last day with us here at News 3. Boy, is it a bittersweet day.
Yeah, it's a tough day for us,
We're
Dave.
happy for you, but very sorry to see you go.
Well, I've really enjoyed the last 4 years here. I've had an opportunity to work with a very talented newsroom staff here. But I've also had an opportunity to share the stories of some great people here in Wisconsin, and I won't forget either.
What's next for you?
I'm actually jumping into a new chapter. Literally, I'm writing a novel. It's a project that I've been working on for a couple of years, and moving it forward and actually starting the writing process.
No, we had Dave for 4 years here, but his career is far greater.
45 years.
45 years in the business. We were very lucky to have your talent as long as we did, Dave.
Well, I was very fortunate to find this place, too.
Well, thank you,
We
Dave.
can't wait to have you back when the novel's turned into a movie. That's
going to do a story on that book.
That'll be exciting.
There you go.
Congratulations, Dave.
Thank you.